many do we need? Oh, okay. Okay. Well, that's what I thought, but I was like, oh, I don't want to say anything. Okay, perfect. Call this meeting to order at 4 o'clock.
Congratulations.
Yeah. Stand for the pledge of allegiance. Pledge allegiance
To the flag, United States of America, to the republic for which it stands, nation, indivisible, for all.
I'll go ahead and do roll call. Committee member Horton is not here. Committee member Grants indicated he would be absent. Committee member Knowles.
Here.
Committee member Jones. Here. Committee member Schumacher is absent. Vice Chair Dalton
Dalton, here.
and Chair Ray.
Here. Thank you.
So we don't have.
Alrighty. So approval of minutes from March 19th meeting. Do I have a motion? Want to review them?
I would move to approve.
I'll second that.
Aye.
Minutes approved.
Now it is.
Do we have anyone online? Okay, and no visitors here. Old business. So the community needs letter. I have a couple things with that. The first one being I had a reporter reach out to me to discuss the community needs letter and why the committee felt the need to write the letter out to the churches. And then to just ask about what currently is being offered in the way of like warming and cooling shelters here in Sweet Home. And so at first I wasn't sure what she was wanting. And so I called back and she asked her questions. And so I just shared the information that we have from the city about the library, the police station, and City Hall during business hours. And then she asked like why we wanted to send the letter, and just because I think there's been a lot of emergencies that have come up or things that maybe the public's not aware where these services are being offered. And also, I think when we found during the creation of our resource list, there's lots of services that are currently going on in our community that are really great that we as a committee didn't know about. So I shared that, and that was the end of her questioning. So my first question, I guess, would be, am I allowed to talk to reporters?
That is a really good question. I don't know if this has come up before with committees.
I don't think it has come up before.
So I guess I'll have to get back to you on that.
Okay.
Yes.
Because she asked about the letter and the
Mhm.
email she had sent, and so I just like called her back to discuss the letter, and then she was asking questions about current services, and then I was like, oh man, did I just open up a can of worms? Or so then I was talking to Bob about it, and he's like, you need to follow up and just say, hey, should I have done that?
Yeah.
Yeah.
I think to err on the side of caution, you can just refer them to the city manager's office,
Perfect.
and then that keeps you out of any trouble.
Well, especially if they're asking city related questions.
Yeah.
I think that needs to come
Well,
from
let's-
leadership.
Yeah.
And
Like,
Yeah.
Yeah. You
Okay.
can just redirect, and that's
Okay.
totally
yeah,
fine.
I think that's why it hasn't come up. Normally people want to avoid the media, so they just automatically redirect them to the city manager's office.
That you sure don't want them to come out and say, well, I talked to this person and this is what they said. And it's like, oh, now you're in the newspaper.
Could I offer a little bit of experience voice here? I totally agree. It should be put back on somebody, probably not Kelsey as a committee, different as a counselor, but maybe try to come up with a basic format that people can use, and then we can share it with each of us, because it's not just Kelsey that might get a call like this. And you can come up with this is something we're aware of, we're working on, and please contact the city
Gotcha.
manager.
Yeah, we can come up with
As
some
opposed to.
verbiage.
Because this is what happened. I was a vice chair and the chair kept saying, I don't talk to the press, click. Oh, that's probably not a good thing.
Yeah, I
Uh,
had gotten back from vacation and had several missed calls and a couple emails. And so I was like, oh, I feel so bad that he waited. I was on vacation.
Yeah.
So I was trying to respond. And then I was like, maybe I should have called Cicely.
I think every committee
Every committee should have that.
just have a little basic
Mhm.
what to say, and then you'll know that everybody's saying the same thing rather than,
Theoretically, yes.
well, yeah.
Should be saying
I'll
the same
meet you at the
thing.
bar later, yeah.
So yes, and then second on the community needs letter piece is I've only received one response so far, and I didn't know what we want to do with that. Do we want to follow up and send an additional letter? Do we want to just let it lie for now? Like I know I had suggested, oh, maybe we send a letter based on the discussions we were having, but I just don't know how much further we want to go with that if we're not getting responses from people.
I'd like to see a second response, second letter if possible. If you're comfortable with it.
Okay.
Too many meetings on Wednesdays. Yeah.
Welcome. You haven't missed
Thanks.
much. I asked about so the community needs letter that we had sent out to the churches. I just said that I've only received one response so far from all of the churches in Sweet Home that received the letter. And so I asked if we thought we should send a follow-up letter or maybe not even a second letter, but just another response asking if they received the letter, if they had time to review it. I think that might be better.
That would make sense.
Yeah. And just see if we get any additional responses after that. Okay.
How many did you send out, just out of curiosity?
I'm not sure how many went out because I'm not the one who sent them. I forwarded them on to Mayor Coleman, and I believe she had a contact that sent them out too. So I'm not sure how many congregations actually received the letter, but I can ask.
Oh, there's a
All of-
lot of churches.
Yeah, all the more reason to send a second one. then,
Okay.
Just to make sure they got it.
Yeah.
I need new glasses.
Okay. And then partner presentations. I know Lynn County is one we're wanting to present and is said that they would like to present. I just don't know that we've ever nailed down an actual date this year.
Yeah, so the last that I've made two different contacts and I'm not sure how much they overlap. And so they've both indicated they would be interested in coming, but they're not quite ready. So probably in June or July.
Now, Lynn County is a pretty broad,
Yeah,
are you talking specific, like what agencies?
Healthcare and,
both in
mental
mental health.
Mental
Yes.
health?
Mhm.
Okay.
so I contacted the health administrator this morning because within the group, the mental health program director and the health administrator were kind of arguing between two groups. And the mental health person is coming to another group that I'm part of with the understanding that the health administrator would come visit us. So I emailed him this morning and I checked just before I came and had not heard from him. You think you're busy?
What's his name?
Noble.
That's what I thought.
And he's got union negotiations, the budget, yada, yada, federal stuff. So
Yeah.
I'll let people know when I hear, but the response I got from the mental health person was that they had already talked about it, that someone was planning on coming. It was just timing.
Yeah, good.
So we've got at least that person. And if I might, I got a hold of the hub people. They also are coming to another group that I'm part of. So I think they're just kind of waiting for an additional contact from us. And I was, since I've got the phone, I was going to ask Wanda if there's a possibility of suggesting maybe this is the Samaritan Hub, and if there's a way to find an area, a room, or something that they can use in the new clinic, just to not set up even a potential room, but be able to offer them that there's a way that they can, that something is be available, since it's part of the Samaritan system. I don't,
You mean to meet with patients?
we've been trying to set up community meeting kinds of
Oh.
things.
Living well classes.
Diabetes, that kind of stuff. And they're doing a fair number of them actually in the area. And I thought, the clinic would be a classic place to get started on a routine. And the providers in the clinic could be aware of something that was going on, kind of put us at the forefront at the beginning and then go from there.
I will.
So maybe if you could check,
I will.
because whenever I talk to them, I don't have a way of, we're going to meet at, Kelsey's house. It probably isn't going to work. But they are interested. Yeah.
I was trying to think. There was another group that is it FAC? Where is FAC gonna come present this year?
If you wish.
Yes. Yeah.
It would be nice if we sent them an invitation.
yeah.
Send it to the executive
Do
director.
you know Candace? Oh, I know Candace. So I could invite her.
Oh, I can invite her. I
Why
just
don't
think
you
it would be
invite her?
nice if,
Well,
it sounds like the city is sending out invitations. So
it's just us.
Yeah, I think we set up all the ones last year. I don't have anything on the agenda for June or July. So if anyone wants to come present at those, I think there's room for them.
Okay.
So either of those.
would you like for me to contact Candace and
Why don't,
Yeah,
talk
I
with
would
her
love-
about a date either in June or July?
Yes, please.
I'll do that.
And then any other partner presentations that we're missing that we didn't get last year that,
Well, the only one I'm working on right now is with Jeannie Davis, which is out of Samaritan. I'm working on a project with her to get her students want to come out and do an outreach into this community with physical therapy, where they would actually either come to a person's home or come to a clinic that offer physical therapy, because they have 30 hours a year they got to do. And so she thought about piloting that program out here. So I'm meeting with her. I was supposed to meet her this week, but she had to change it. So I'm looking at that as a possibility to come in here and probably give us a presentation of how that program works. But it's something I was asking for because our daughter needs physical therapy, and sometimes it's hard to fit into the schedule. But I said, what about in-house to people's homes? And she thought that was a good idea. So we're kind of collaborating with that. So that looks like that might be a potential at some point.
Would they be willing to do something like home safety? Home safety or, for like the senior center?
Yeah, I think they're open to anything like that. If it was something to come to the senior center and do a physical therapy type outreach thing, they could do that as well. So I think there's lots of locations. We
Okay.
just got to kind of get the logistics down as to how that looks. So, but I'm looking forward to it because to get students to come out and do that, and especially out here, it's just another service to provide. And if they could do it every year, then because it'd be ongoing.
Beautiful, thank you.
Now, we talked about our part of the outreach, our goals. I don't know if that kind of fits here, but I was thinking about what we want to do with Rotary.
What do you want to do with Rotary?
Well, what we had talked about, I don't know if this is the right place for it, but I guess it's as good as any because it's presentations, was Kelsey had put the slide program together about this committee
Mhm.
and what we were
Oh, to
doing.
do one for Rotary?
Do it for Rotary where you
That'd be
got all the
great.
leadership sitting in there. So
Yeah, that would be excellent. Sorry, Kelsey.
No, it's okay.
Well, it's a fairly short presentation anyway,
Yeah,
so
what you're talking about is a nice lunch, a really nice lunch at 11:45 to 12:15.
that was our whole point.
12:15, you have to listen to a little business. And at 12:30 to basically 12:50, you give a little 15 to 20-minute presentation on what we're doing. How's that sound?
15 to 20 minutes?
You can do
There
it.
is no way I spoke that long.
You can include time for questions.
Okay.
You know, and while we're talking about it, I meant to congratulate how well she
Yes, she
did
did
at
an
the city
excellent
council.
job.
Larry and I were
Absolutely.
there and it was very well.
So thankful.
What
Well
you
done.
do
Well
is
received.
just stretch
It was-
it
it was very well done.
out a
I can
little.
talk that slow. I get too excited and I talk
It
fast.
was really well done.
No, you did well.
Yeah.
And if you only go 5 or 10 minutes, actually, that's not a problem either because everybody enjoys getting done early.
Yeah.
So
Kelsey, I'm wondering if you know anything about the Lynn County food program that involves farmers. I'm doing some work with the IHN clinic in Albany, and they are receiving help for their patients who have food insecurities. And they're delivering 2 boxes a month. So every other week, they're delivering food to these homes. So it's actually delivered to them. They have to be identified as having a need, but it sounds like an amazing program. And I know they've been doing it in Corvallis for a while, and they're spreading into Albany. You know, we don't have the same level of farming over here, but I'm wondering if Eastland County might also qualify in the future.
Is this through the county or through IHN?
It's through Lynn County,
Through Lynn County.
the
Okay.
program is.
I will have to look. I have not heard about that. I'll have to look into that and see.
I'll see if I can
It's a
get some.
farmer's market. Yeah, send it to me as well. I'd like to see that.
The Shem does I think they have a contract or a grant or something through Two Ponies, which is kind of a local farming area and natural foods, and they deliver to Shem food boxes and whatever. And Cindy at Shem does have a contact with some of the local farmers, like when the fields have been picked and there's food left over in the fields, she'll go out and pick it. I mean, so getting volunteers to go out and just do that food is available. It just sits in the fields and goes bad.
This program, they actually are delivering it to the homes. And one of the things that has been discussed is they have to have the ability to prepare it. So for some people, it really doesn't work. They don't have a home they don't have a stove, they don't have a way to prepare it. So it's identifying people who would use it and it would be of assistance. So I can check into it more as well,
Thank you.
see what I can find out.
I'm just wondering if that's a possible another topic, just the food potential shortages that we're looking at. Because I have a feel, I know FAC said that their food has been reduced drastically. And my guess is other food agencies are
I'm hearing
getting
that.
reduced.
Yeah, Shem has been reduced significantly.
So maybe, that could become a very big health issue in our community. And I'm just wondering if we need to maybe get a group people that see the need in here to talk to us about that. And, is there anything we can do about it? I don't know. All the cutbacks, it's hard to say what's,
Yeah, it's a moving target, isn't it?
oh man, every day.
Well, I think, even at the health fair that, we serve the most vulnerable group that comes through there. And I can't think of what she's talking about wouldn't be applicable to
Oh,
the
yeah.
ones that visit our health fair, is that they had a presentation there where people could see it and even sign up for it or qualify for it. So
I'm sure there'd be a need.
there'd be a need.
Would you scare her?
You're scaring me.
Any more about partner presentations to us or from us to people in the community?
I have my walking orders, 2 of them.
moving on to the community health fair, the Sweet Home Community Health Fair.
Sweet Home Community Health Fair.
Yes.
Well, I'm currently just reviewing the old application, see if the update, I'm going to update the flyer this year as well. So I'll do that differently. I was thinking about reaching out to somebody that could actually maybe help me with the flyer to make it a little bit larger and brighter. You know, I've seen some things that has been done on a bigger poster size.
We could probably help with that. I know Park and Tree gets staff support for designing promotional
Yeah, maybe I'll
materials.
talk to you a little
Yeah.
bit about it, but something a little bit bigger than what I do on my printer at home that,
Sure.
you know,
Yeah,
so, but it'd
definitely.
be kind of handy. And that's really about it. I've went through the list with Kelsey and Dick, and we've kind of updated that and added some things to it. So still on track. Applications will go out in May for that. So that's usually pretty early enough to get it out.
Do you have a date for it?
It's the
Third weekend in August.
Third
the
Saturday.
Saturday. in August. I think it's the 16th.
16th, I believe.
Yeah,
is what it
16th
is.
this year.
16th, August 16th?
Mhm.
Yeah.
Do you need setup help again, I assume?
Still need people with tables.
Okay,
And usually I get the tables through.
we'll get a
the-
working crew there.
Younger
Yeah.
this year.
Hey.
I don't know, you know,
We're
with,
getting younger, aren't we?
who does banners?
So if you're talking about the ones over 20, those are no longer being approved.
Right,
Yeah.
I've got
So,
those.
so it's no longer a city thing. Basically, everyone's hoping Thriftway will let them hang their banners.
That's, I always usually, they don't have no
Yeah.
problem with me hanging it. It's a
Yeah.
good spot for it because you see it really
Yeah,
well.
but that's about
I was
it.
thinking something on a smaller scale, something like
Mhm.
4 or 5 feet that could be put like at the Chamber of Commerce out
Mhm.
there on Main Street.
And that would be up to those owners.
Yeah. I just didn't know because the ones I have the Sweet Home logo on them. So.
And that's okay.
Samaritan.
I mean, I think obviously the health fair
I
is
just.
part of your
does-
charge.
Does the
so
city have anyone that they use for
I-
banners or anything?
We do, but
Okay.
I'm not sure if this falls under our recommendations where we're not.
Yeah.
Oh, I
mean,
just thought maybe you knew of a company or
I
someone
can
that
certainly
did
find
it.
that out.
I
for
mean,
you.
I can look online.
Yeah.
probably
No, we
find
can
it.
definitely
I
provide
can
you
talk to you
contact.
after the meeting.
Okay. That's actually all I have.
Nothing wrong with being done early.
Nothing wrong with it. We pretty fast.
I do have something that, I mean, I guess it falls under committee business for the good of the order, maybe. I know one of our goals is to put on a health forum, and I think that if we want to get that accomplished before the end of the year, we should start talking about it as soon as possible and what we want that to look like and start getting a plan together because I mean, it's already April. How did that happen? So I just think that we should start getting an idea of what that will look like because I want to accomplish that goal that we set last month, but it has been a goal in the background of this committee for 10 years.
Is that something you think would fall under kind of what, Mr.
Yeah,
Knowles was
that's kind of
talking
what I
about?
was thinking. Maybe collaborate with the new clinic and use their a room or something. And
And so do we envision that being a specific topic, an educational topic?
I know when I know when we first brought it up, we wanted to do a mini health forum for all kinds of different topics. But I think we really got away from ourselves for a long time and just kept talking about this pipe dream of, oh, we're going to offer up all these mini little health forums, or we're going to invite a presenter to present to a large mass of the community, someone from that comes to the health fair. And so I think it just was talked about for so long of, oh, we're going to do this, we're going to do that. I think we need to narrow it down and have it either be resources, like one presentation where we present all of the resources and have all of the information from like the resource list, or we pick a specific topic that we want to focus on that we maybe it's something that we heard about from when Western University presented their study, and it's something that is important to the people of Sweet Home. They've said this is important to us. We want more education on it. We focus on that and find a local knowledgeable expert on that topic, and that's the first one we host. Those are my thoughts. I don't know what everyone else is thinking or wanting to see, but I just want to get going on it.
I mean, it's a new frontier for us to
Yeah.
take on something like that. We don't know if you'd have 20 people there or 100 people there. I think the concept was it'd be kind of open. It could be a subject like, dealing with being a diabetic or something, or dealing with cancer like I'm doing. I mean, something that someone can come and give you a brief talk. Could be mental health, because we talk mental health a lot, and I'm thinking mental health isn't a bad topic to throw out there, that, living with mental health, and let people open up and ask their questions to somebody that's expert in that field, I mean, that's kind of what we're looking at, something to that effect. It's narrowing it down to what topic and what would be interest to people,
We'll get started.
So I guess my question back to Kelsey, if you want to do it this year, is there a month in particular that, I mean, you got to think about the activities that are happening
Yeah.
during summer months.
Well, and you're having the community health fair in August, so I wouldn't think that you would want to have those overlap too much.
I mean, in the winter months, I don't know, September, October, maybe.
I think it'll also come down to we need to find space and have like a set
Yeah.
space. I would like, not even necessarily this year, but before we present again to council next year in March or April about what we've completed, I would like to say, hey, look, we set out to accomplish this, and this is something that we accomplished that was on our list of things even prior to becoming an
Yeah.
official committee. I think they'll just take us more seriously, and they'll see that we're trying to get things done.
So Kelsey, what do you want from the committee members? Do you want us to send you some ideas so you've got it collectively, or?
Yeah, I mean, I definitely don't want to do it on my own.
I have two things. Angie Fredericks is excellent with diabetes education. I've been using her now for a number of years, and she has over and over again said she wished she could do more in Sweet Home. This might be an opportunity that she could do more in Sweet Home. She tells me she has talked with the powers that be, and they won't move any kind of diabetes education for her to hear. But maybe something like this, a one-time shot where she would come in and could give ideas to, I mean, I don't know how many diabetics there are in this community, but I bet you 50%. I bet you 50% of our community is diabetic.
I mean, probably everyone in this room knows somebody that's a diabetic.
Yeah. That's number one. So I would say Angie Fredericks would be a really good place to start as a potential. And number two, Rotary this last Tuesday had a gentleman that is in a wheelchair that found out several of us at the walking for the kids' abuse awareness. He had his fiance pass away from lung cancer. And so he came up to several of the Rotarians and said, I want to talk to your Rotary Club. And so he did. He came and talked and said, what can you guys do to get the word out that smoking's bad for you? And what can you do to get something on lung cancer so that the community knows about it?
Go to the infusion center
lot.
with me.
There's a lot of people, cancer has now touched, I would bet, almost every family in the United States in some way.
With the cancer I'm dealing with right now, it's an oddity because of the cancer I have is less than 1%, so it's very rare.
Well, look at who has it.
Yeah. I mean, I've lived as healthy as I can.
You're pretty rare.
Yeah, probably. But, what I've learned in my journey is the attitude you take towards it,
Yeah.
dealing with the emotions of it. I mean, I'm reading the heck out of a couple books right now. That's one called Radical Remission for people that have stage 4 like me, that thousands of them have come away cancer free by just switching their lifestyle and their diets. And it just,
And their
it-
attitudes.
and their attitudes. And that's my attitude. I'm
Yeah.
leaning into it, and it's mine. I own it. It's nobody else's, but I sit in that infusion center and I see people from all walks of life, from children to
Yeah.
middle-aged to seniors, that
Well,
are all
Rotary-
dealing with some sort of cancer.
Rotary was thinking that we might try and get something during Cancer Awareness Month. And I guess there is a month called Cancer Awareness
Yeah, there
Month,
is.
and that we might try and put something together for
And,
that
and it's
month.
good for people, probably like myself and others, to talk about your story a little bit, so people will open up and talk about it,
Yeah.
you know.
Yeah.
Going along with that train of thought, Larry, that you started is the loss of a spouse. Because I can name at least 6 people in the senior center off the top of my head right now that have lost their spouse. And yeah, and dealing with that and helping people to kind of begin that process of working through it. I mean, we're not going to be counselors, we're not going to be solving their problems, but just to have them be able to open up and share their
Yeah.
their hardship and
Yeah.
stuff with people. And that's a big thing in the senior community.
Okay, that's my
There's
2
your
cents.
There's your list.
Yeah, so I just wrote down that I think what we need, or I would need help with, is space, deciding the topic of discussion, a date and time, and then 1 to 2 experts to come talk about it. In that order or not in that order. I mean, they'll all fall together eventually, but
My guess is the senior center might be open to something like that. And
Absolutely.
then they can
Yeah.
usually handle a number of, 100 people pretty easily.
Yeah, if it's on the weekend, we can open up both of the dining rooms, and if it's
Right.
reserved well enough in advance, we can do that. And there's even a little kitchen area that we can use. Yeah.
my next question to that would be, is there a cost? Like, would the committee need to come up with funds to cover a cost of renting a space?
Depending, I could talk to Dawn, to see if, since it's a city thing, would they charge or not? And I will talk to her and get back to you.
And I can also talk to her if we need a little pressure.
Okay, all right.
Because I think that has been some of the hesitation too, is like, where do we come up? You start talking about like hosting public meetings and inviting people in and finding a space. And it's like, okay, where's the money coming from? How are we paying for these things? So those were just-
Rotary would probably be willing to help with some funding.
I also had thought about like looking at the I feel like we either have it somewhere or I'm sure we could get access to it. The study that Western did when they came and then they presented it to us,
Yeah.
and they said the different things during the focus groups that the community of Sweet Home said that they wanted education around. And so looking at that presentation and either us hand picking something, or I was wondering if we could put up a poll on like the city's website on our behalf, asking citizens out of those topics, what would you like to, especially because then too, I feel like we could cherry pick to say, hey, we have experts we know that could come talk about these 3 things. So let's choose these, put them on the website and do a poll and see
That's
what
easy
people
enough.
would even want to come to.
Yep.
Because I think
Good
that's a
idea.
good way to
Yeah.
gauge.
It's a good idea.
Well, you find interest that way.
Clever
Yeah.
idea.
And Bob, I think, has that presentation, don't you?
Have what?
You have that presentation that the students did,
Yeah, I have that.
Okay.
because I know you've shared
Yeah.
information from it before.
So I think, yeah, we look at that and determine out of I don't even remember how many topics there were, but out of them, do any of us know a knowledgeable expert in that field that would come talk to the community? And if we do, okay, let's put that in the poll and
Mhm.
see what people would show up for.
Yeah, at Shem, there's one of our, I don't know if she was an employee or volunteer anyway, she's a minister with one of the local churches. So I could ask her if she might be interested in the loss of a spouse. and if she has some more expertise in that area or knows somebody. So I can do that one.
And the thing, you know, when you pick someone to present, I'm speaking again from my own personal experience dealing with what I'm dealing with, but depending on who you're talking to, some people have the real standard format they use. And it's the same one you get all the time, every place you go. And actually, I find more information talking with my care team and my nurses than I do my doctors. I mean, they have a different perspective. Doctors are just right, this, and this, and I'm an out of the box thinker. But most of the people in that room I sit with, even during chemo, I've made relationships with the other patients, and you find so much more there that's personal that they want to talk about than what you're going to hear in a doctor's office. So, you know, when it comes to presenters, there's good ones, and then there's the standard what you get.
Cookie
And
cutter.
yeah. So I think it's really important to find that person that can really connect with the audience.
Yeah.
That's like 1 to 2, because maybe we have like a mini panel that if one person feels more confident, or it could be depending on the topic, we have a quote unquote expert in that field, but we have someone with lived experience. So they can speak to some of the questions people have of will this look like for me? What's to come? Not just the medical side,
Yeah.
the life side.
Because there's the emotional side up front.
Yeah.
That's the big one. You get through that and then you break through, you know.
That's all I had.
Good.
So is it all right? The med students, Western med students are doing a rural healthcare equity fair. I have a flyer. It's on the 3rd of May. It's a free equity fair. They're doing health screens, youth physicals.
We have advertised that on our Facebook page. Thank you, Wanda, for passing that on.
And this is another one of those Jeannie Davis kinds of things, who's been working with us on the health in our community health there for years. So
Yep.
thought maybe people could go by, and I can give one to Sean too, even if he doesn't want one.
Any other committee business for the good of the order? Going once? Going twice?
Thanks for dragging us putting it together.
4:37, this meeting's adjourned.
That was only a 30-minute meeting.